Visit the Merck Manual. Full access without fees or ads. Thousands of topics written by medical professionals.
I can still picture your perfect teeth, lying so straight and white behind your smile.
Hello again, and welcome to the Merck Manual's Medical Myths podcast, where we set the record straight on today's most talked about medical topics and questions. I'm your host, Joe McIntyre, and on this episode we welcome Dr. David Murchison. Dr. Murchison is a clinical professor in the Department of Biological Sciences at the University of Texas at Dallas. But we have him on the podcast today to talk about his expertise in dentistry. He has been a practicing dentist for more than 40 years and also spent more than 30 years in the Air Force doing comprehensive dentistry and a lot of dental education, as he says. He is also a professor at the Texas A&M College of Dentistry in the Department of Orthodontics and the Department of Comprehensive Dentistry. Dr. Murchison, thanks for coming on the show.
Thank you, Joe. Looking forward to it.
Now, many of us, or all of us ideally, should have some experience in visiting a dentist sometime in our lives or from one reason or the other. But as you told me before we started recording, Dr. Murchison, we shouldn't just see our dentist only when our teeth hurt or only when they're bothering us. Can you explain why that is and how often we should be seeing our dentists?
Well, Joe, dentistry has really prided itself on being a profession that really practices prevention. And so in order to prevent, you need to go in even when your teeth aren't hurting. It allows for a clinical examination, first of all, because we're not only looking at cavities in the teeth or gum diseases we'll speak about a little bit later, but any growths or tumors or unusual findings that we can find. And again, prevention works best when you find things early. And so, you know, a preventive practice in dentistry is the best way to go. And so if you've waited until the teeth start to hurt, that usually means that it has progressed to the point that some intervention is going to be necessary, whereas, especially with gum disease and gingivitis, just a little bit of hygiene, tweaking, a little bit of better cleansing of the oral cavity will certainly help and can reverse gingivitis, and in some cases these days, even reverse very small, what we term small enamel white lesions, which is just a little bit of demineralization, and so you can actually prevent cavities by the application of some topical fluoride or some fluoride varnishes, or very, very small dental restorations before they get large and actually cause the teeth to hurt.
Now, you mentioned gum disease there. You know, I think this is something we've seen or heard of for a long time. Is gum disease something that's rare, not something necessarily that people need to worry about, or is it more common than people think?
Much more common than people think, and gum disease actually, in most of the Western world and really probably across boundaries, is by far the leading cause of tooth loss after, say, the age of, late 20s, mid-30s or so. And it has to do with the loss of bone that accompanies periodontal disease, periodontitis, which is an inflammatory disease. And so gum disease is not rare. In fact, it's a very, very common occurrence. As I said before, as we age, it becomes the most common cause for the loss of teeth.
Now, I have seen some fodder online that says gum disease may not just be a concern only for your mouth. Is that true?
That's very true. There's been a link between actually gum disease and some cardiovascular problems because it's a disease that is set up with inflammatory aspects. And so inflammatory aspects from cytokines and other kind of localized that can become systemic effects, it can actually set up as a potential for cardiovascular problems. The second thing is it's exacerbated by specific systemic problems. And so if somebody has a compromised immune system by, say, something like diabetes, leukemia, it advances the progression of the periodontal disease or the periodontitis or the gum disease. And so all of these things need to be taken into account, and that's why your dentist takes a very thorough medical history as well as doing a clinical evaluation when you go in for your annual examinations.
So one myth that we've also seen a lot online, and I'm sure many of us have heard sometime or another when we were kids, is that chewing sugar-free gum can be either a substitute for flossing or, a worst case scenario, a substitute for brushing your teeth. I'm assuming that's not the case, but can you explain why?
No, certainly not. Now, sugar-free gum is certainly preferable to sugared gums because it doesn't allow the oral bacteria to feed on the sugars, and they can be glucose or sucrose or all kinds of the sugars that break down to cause acids that actually are the cause of tooth decay. Sugar-free gum is not a substitute for flossing because it doesn't reach those especially hard-to-reach areas, which are between where the teeth meet each other, or what are known as dental contacts. And that's where food debris and plaque tends to collect. And so the flossing is able to go in there, remove those bacterial colonies, which are dental plaque. And the flossing can get in there where gum cannot get in between the teeth.
Now, along that same vein, are diet sodas technically better for your teeth because they don't have sugar in them?
They are, but again, everything in moderation. Diet sodas, because they have saccharides or sucralose or other different kinds of artificial sweeteners in them as opposed to sugars, they don't feed the bacteria. But the problem is they're carbonated and they're acidic. And so it's the acids that tend to work as well. And so we see a lot of people, when I was in the Air Force, we had a lot of people that had jobs where they either had to listen in for a long time or they were monitoring things, and they sat there with a carbonated beverage, a soda, a cola, and they were sipping on those all day. And it has to do with the acids working on those teeth all day long. And it's the same thing if you have sugar in your coffee. And you're sipping on the coffee all day long, and so it's an exposure duration, and your saliva just can't buffer it for that long. And so those people tend to have a lot of dental cavities because they have acids working on the teeth all day.
So it's not only sugar that's the cause of tooth decay, but it's acids, carbonation, and sugar that combine to cause this issue.
Correct. And again, especially for people, let's say, a medically compromised person that has had some kind of head and neck cancer that has gone through radiation, and the radiation has diminished or completely taken away their saliva flow. Those people are at high risk for dental cavities, and it's because there's no buffering effect that's left in the saliva. The saliva also contains some semblance of fluorides, and so, again, saliva buffers that, but if you're continually challenging that with a very low pH carbonated beverage, a sugar-containing beverage as well, that forms the acids from the bacteria, you're going to overcome the protective aspects of the saliva and the fluoride that you use in your toothpaste and start to have those demineralized areas that form cavities.
Whether you're a parent or a seasoned professional, a medical student or a caregiver, the Merck Manuals has the right medical information in the best format. And it's always free, easy to access, and readily available for you. Let's talk a little bit about how we can prevent some of those cavities. One main key aspect of that, I'm sure, is brushing your teeth. Now, when it comes to brushing your teeth, does it matter what time of day you do brush your teeth?
Every dentist, I think, will recommend, brushing after meals, and that helps to remove, food debris as well as break up the bacterial colonies, the plaque that's in your teeth. But certainly in the morning, before or after breakfast, depending on what you prefer, and then right before you go to bed at night, at least those 2 times a day, twice a day brushing, will break up that dental plaque that we were talking about. That's the bacterial colonies that harbor those bacteria that can cause both the gum problems, the periodontitis or the gingivitis, as well as the dental cavities, the dental caries there. And so by breaking up those cavities, you're able to do that.
Now, I've always been told growing up that I should have a soft bristle toothbrush, but you would think that having hard bristles may be more likely to remove some of that plaque and debris that's in your teeth. Is that not actually the case?
No, that's exactly that's exactly opposite. The hard bristles have been shown to really cause a lot more damage, and the soft bristles, two aspects. One, they're not as abrasive when you're using it with the toothpaste, and that's what you're doing is the bristles themselves are taking the abrasive portions along with the sudsing portion, which is a sodium lauryl sulfate. It's kind of a detergent in our mouth. But in terms of actually the toothbrush bristles themselves, the soft bristles get up under the gum tissue, remove the plaque better. The hard bristles tend to be more abrasive, and they don't splay or move in under that the gum tissue as well. They can also cause damage to the gums, so we don't want to do that. And we don't want to cause any recession, which is an actual moving of the gum tissue away because of either a habit, a toothbrush habit that's too hard, or a fingernail habit, or somebody has a bobby pin or something like that they use. And so there are a lot of pernicious habits that hurt as well. But hard bristles are not good. Soft bristles are good, and especially for children.
Now, you mentioned brushing hard. Is there a recommended pressure that someone should use when brushing their teeth to avoid brushing too hard and causing some of that recession that you mentioned?
Joe, what you really don't want to do is just a back and forth motion. It's more of a rotary or kind of a roundabout motion at about a 45-degree angle toward the gum tissue, and that allows for those bristles to move up into what's known as the sulcus, the gingival sulcus, which is a little space between the gum and its attachment to the tooth there. And so by doing kind of a back and forth motion as opposed to a tremendous amount of brushing hard and a straight force, by using that rotational motion, the circular type of motion, you're able to remove a lot more of the plaque, and you don't cause the same kind of problems with the enamel.
Now let's switch over to something that people look up online, whether it's in the Merck manuals or just simple searches online all the time, this idea of how to make their teeth whiter. Everybody wants to make their teeth whiter. We've seen remedies such as lemon juice on your teeth, charcoal, coconut oil. Are any of these quote-unquote natural remedies helpful for whitening your teeth, or are they quite exactly the opposite and actually damage your teeth?
Lemon juice specifically, and we actually see a lot of that down in Texas. There are cultures that tend to actually suck on lemons, and you get a lot of acidic erosion of the enamel of the tooth. The enamel is made of calcium and phosphates, a material called hydroxyapatite. And the problem is when you have a very acidic material like citric acid that comes from lemon juice or oranges and things like that, it actually erodes as an erosive agent for the enamel of the teeth, and we see a lot of the enamel loss. You mentioned charcoal. That has not been shown as being as efficient in removing the plaque of the teeth, and secondly, doesn't have the addition of fluoride, which is really, really important from a preventive standpoint. The last thing that you mentioned, coconut oil, is used again in other cultures, specifically known as a pulling technique, where you place coconut oil in your mouth and then swish and try to move it between the teeth there to try to help remove the dental plaque. The problem is most of that requires 10 to 15 minutes of swishing your mouth. Well, I've had children, now I have grandchildren, trying to get them to brush their teeth for 5 seconds, much less 10 or 15 minutes of this pulling. It's very, very difficult. And so I can tell you the American Dental Association has no research that shows that there is a preventive aspect or a better aspect from the coconut, the use of coconut oil alone. And certainly as an adjunct, they haven't shown that it's detrimental, but brushing and flossing twice a day with fluoridated toothpaste is the recommendation from the American Dental Association.
Is it true that when your teeth are whiter, they're healthier?
They're not healthier, Joe, but what they have done is removed organic stains. And so these are the stains that come from coffee, wine, different kind of fruits and vegetables, beets and things like that. And so the hydrogen peroxide actually removes those stains. It's a transient kind of thing. It's temporary. It lasts for a little while. And certainly there are some techniques also if you go to a dentist and they do an in-office bleaching, some of the dehydration that happens to the teeth will make them appear brighter as well. But these are relatively safe. Again, moderation is the key. And so if you bleach, either a home bleaching or an office bleaching regimen that's followed in the recommendation from the manufacturer's materials, you can whiten those teeth. But again, it's a transient kind of thing. And to keep that same whiteness, you're going to have to either change your diet, away from a lot of different things, or get this done on a periodic basis.
Now, we've talked about the importance, obviously, of brushing your teeth. Can you get a little bit into flossing, why it's valuable, why it's important, and how it helps us remove some of that plaque that brushing may miss?
Flossing gets between the teeth, and it gets under the gum tissue, and when done correctly, it breaks up the bacterial plaque, and so they don't have the chance to colonize down there. And for cavities, by breaking up the bacteria, they haven't had time to demineralize the enamel of the tooth. And so, again, they have to take in sugars, take in different starches and things to break them down into acids that cause the dental cavities. And so the floss just breaks them up and then allows, again, in use in conjunction with brushing, the removal of that dental plaque. And so by using flossing, by having the dentist go down and remove some of the calculus or the tartar, which is the harder deposits of the teeth, you've removed some of the nooks and crannies also that tend to form down there. So by preventing that calculus or the tartar, the floss again is removing the plaque so it doesn't harden to form an area again that then those anaerobic bacteria can form underneath to actually cause the progression from gingivitis to periodontitis or the gum disease.
We've seen this a lot online. I'm sure it's not necessarily true, but I want it to come from your mouth. Does flossing create spaces between your teeth?
Flossing does not create the spaces of the teeth. What usually happens is we get drifting of the teeth, and this is especially prevalent in patients that have severe periodontal disease. And they lose bone support, and the teeth start to move, and specifically in ways that the mouth tends to function. And so as you move your lower jaw forward or a protrusive kind of movement, it can actually work on those upper front teeth, and you start to form some spaces in there. So flossing is not the cause of that. It's the loss of bone.
Now, it can be easy when someone is flossing to see some blood maybe in their spit when they're cleaning out their mouths. Is that a reason to stop flossing, or if you're brushing your teeth and you see blood, to stop brushing?
The blood is showing that there's an inflammatory process going on, and so the body reacts to inflammation in a couple of different ways. It sends more blood supply there to send some of the kind of white blood cells and lymphocytes and things that tend to fight inflammation. And so, first of all, you start to get a redder looking area, and that's why gingivitis tends to have some red gums. You tend to have edema or a swelling in that area, and so the gums tend to be swollen as well. And then finally, if left long enough, you can actually get little abscesses in there, and so you can actually get some purulence or some pus coming out of those areas. And that, again, is usually an indication that periodontal disease has started with the loss of bone associated with that as well. If it's kept in gingivitis, again, so if it's bleeding, that shows you need to spend a little more time not brushing harder, but a little more thorough to remove the bacteria. And you'll see that with continued flossing in that area and continued brushing, taking a little bit more time, and if necessary, having the teeth cleaned to remove any of the tartar or the calculus in that area, you'll see the bleeding finally reduce and then hopefully go away.
Now, speaking from personal experience, a few years ago, I switched to sensitive teeth toothpaste, because I was dealing with some sensitivity in my teeth. Is tooth sensitivity only a result of enamel loss?
Joe, actually not. It can be associated with enamel loss, but it is often associated with a little bit of gingival recession. And so it tends to be just as the patients are moving from, say, the late 20s to the 30s to the 40s, and you're starting to get a little bit of gingival recession, or the gum tissue moving down toward the root of the tooth. And where the enamel and the cementum meet there, if you have an aggressive brushing style, if you've had a cavity in that area, or more frequently, if you tend to have what are known as abfraction lesions, where you've formed kind of a V-shaped area where you've lost some of the cementum due to some motion of the tooth, some flexing of the tooth in that area, you've now exposed dentin. And dentin is a vital structure underneath both the enamel and the cementum, and it's made up of little tubules. And those tubules are what cause the sensitivity, because they are fluid-filled, and the movement of that fluid stimulates some nerves that are down near the nerve of the tooth itself. Now, about 10% of the population is born with a gap between the enamel and the cementum. And so if you happen to be one of that 10%, as soon as you get a little bit of gingival recession, when you drink some iced tea, or you drink something sweet, or you drink something very hot, it causes that stimulation of the dentin. And so there are a couple of different ways to handle that. You can put a restoration on that. That's invasive. You can apply a desensitizing agent, which works for a little while. Or you can use, as you just spoke about, a desensitizing toothpaste. And most of those contain potassium nitrate within a toothpaste or some types of gels. Some bleaching agents even have some potassium nitrate to try to reduce tooth sensitivity. But by using that, it actually acts at the source of the nerve near that tooth. But the thing is, it takes a certain amount and a certain amount of time of that sensitivity toothpaste. And so if you go to the dentist and they recommend that and you ask for that because of tooth sensitivity, they'll usually say give it 4 to 6 weeks, because it takes time for the actual activity of the potassium nitrate to work on the nerves themselves.
All right, as we kind of wrap up here, Dr. Murkison, I want to talk about wisdom teeth. I had my wisdom teeth taken out probably around 4 years ago, relatively painless procedure and no issues afterwards. Can you explain to our listeners why people get their wisdom teeth out and what maybe some of those reasons would be?
It's a individual call for each patient. So you'll be interested to know, Joe, that wisdom teeth tend to be the teeth that tend to be missing at birth for quite a few people. And so some people never have any wisdom teeth, or they're missing 1 or 2, or sometimes all 4, but they're the most commonly missing teeth. And so, wisdom teeth aren't required, for you to be wise. I don't even know where, that moniker came from. But wisdom teeth are third molars, basically. And actually, you'll find that sometimes wisdom teeth don't have to be taken out. Sometimes patients have had orthodontics in the past, and they've lost bicuspids as the orthodontist has moved the teeth around, and they'll have room in their mouth for those wisdom teeth. Some people have large enough jaws that the wisdom teeth can come in and not be covered by a portion of the gum tissue back there, or cause any kind of chronic inflammatory process back there. Unfortunately, for many people, the wisdom teeth come in at an angle, and so they're never going to erupt. And so they cause, at that point in time, a real potential problem by potentially being trouble to the tooth in front of them, the second molars, which we really need for chewing efficiency. And so if the dentist or the oral surgeon that is evaluating the patient for removal of the wisdom teeth decides that the angle of these teeth, their position, is going to become a problem, or if the tooth is never going to erupt and there'll be a continuous inflammatory process and potentially an infective process back there, because bacteria loves to hide under these little flaps of tissue that cover some of the lower wisdom teeth back there. And the problem is the upper wisdom teeth can sometimes bite on that little flap, and it's called pericornitis, which is peri around the crown, corona, of the wisdom tooth down on the bottom. And so there's a constant kind of inflammatory process down there. And so again, You don't want infection in the mouth, and that's what can happen over time. So if you maintain wisdom teeth in your mouth, you need to be evaluated over time with dental x-rays that show that tooth to make sure that nothing is being stirred up by having that tooth remain within the bone over time.
Now, I'm sure we've only just touched the tip of the iceberg when it comes to dental questions or dental myths. We only have about a half hour here, so if someone has a question about a dental issue, a dental question, a myth that they've heard that they want clarified, Dr. Murkison, where should they go for those answers?
Well, preferably, Joe, they're asking their dentist as they go see him or her on a 6-month or an annual basis to be evaluated. And so, again, the dentist is looking at your specific situation, and so they'll be able to give you your specific answers. But if they're going online, certainly the Merck Manual has some great dental authors that write the chapters on some of the things that we've talked about today. They talk about dental emergencies, they talk about periodontal disease, they talk about pediatric dentistry and eruption of teeth and things like that. So there's a plethora of knowledge out there on the Merck Manuals at merckmanuals.com. The American Dental Association provides a lot of free information, and a lot of the dental manufacturers. So you go to your, and again, I have no beholding to any of these manufacturers, but if you go to any of the toothpaste companies that are out there that provide oral hygiene, you can get some information about the ingredients in there for whitening your teeth, for fresh breath, for sensitivity and things like that. But the American Dental Association will provide a lot of information on specific topics, and they use an evidence-based science approach as well. And so a lot of the, quote, myths that are out there, whether it's a material that's used in your mouth, whether it's, some type of potential allergen that's out there, the American Dental Association is a great place to see that.
Well, Dr. Murkison, thank you again so much for joining us. I think this has been a super helpful conversation. I know I've learned a lot about dental health and how to make sure my teeth are protected and as healthy as possible.
Joe, it's been my pleasure to talk to you, and I appreciate you asking me on today.
And I'll leave our listeners with something, as we say every time we do with the Merck Manuals.
Medical and dental knowledge is power. Pass it on.
Thank you so much.